So no, that's another one of the mysteries. We don't understand why people with HIV have not been disproportionately affected, but people with other forms of immune compromise, people who are getting cancer chemotherapy, for example, um, have been at risk, at high risk. And there are so many things we do not yet understand about this virus, which of course we will understand in time, but that would eventually help us understand how best to react to it. But for example, we don't really know how protective the antibodies are that you develop. These are the proteins your immune system makes after it meets, a microbe. And some infections you get once in a lifetime and you never get them again because your immune response is so robust and long lasting. But we really don't know anything about how robust or what the duration of protective antibodies are. Uh, you know, that has, of course, some impact on the development of vaccines too, because the whole point of a vaccine is, right, get your immune system to react to something that looks like the virus or is a killed version of the virus, and that would give you lasting immunity. But after all, like influenza, right, you need a new flu shot every year. So we really don't know. We don't know the extent to which people produce what's called neutralizing antibody. We don't know how effective that neutralizing antibody is. We don't know how long it lasts. We don't know if you can be reinfected with COVID-19, because that all depends on, again, since we don't have a vaccine yet, how protective your immune system is after you've met it once. So there's just a tremendous lot that we really need to learn, and we need to learn it fast because as of today, I think there are 10 million cases worldwide. There are 500,000 deaths. And it's exploding in the United States now, especially after having hit the Northeast very hard. It's exploding across the South and the West. And answers would be really useful, really, really useful now. But it takes a while. It takes a while to gather evidence. I think one of this sort of a glass half filled, glass half empty thing about how knowledge has been amassed and disseminated about COVID-19. And one of them is that people have published very, very quickly. And that's been very useful. That is, all these Chinese doctors and scientists got information out there that, was really helpful. But a lot of the information from China and everywhere else actually has been published as what they call preprints. So before they've been peer reviewed, and the rush even to peer review has been muddied because there's this well-known situation now where two of the most well-respected and widely read journals in the world, right, The Lancet and the New England Journal of Medicine, have each had to retract a COVID-19 study because the data weren't vetted closely enough.